there. My name's Carmen. I am a myofunctional therapist and a myofunctional educator. So I'm happy you're watching. Today, I am going to talk about where to start when it comes to assessment, intervention. I get this question a lot. So this is going to help you at least have an idea. So really, the first thing that I tell people when they ask me this question is to arm yourself with knowledge. And what I mean by that is understand your condition, your impairment, understand why, understand how the symptoms are connected. And what the benefit of this information is for you is that it helps you understand and see the importance of why you need myofunctional therapy. It helps you see the value in that therapy. But more importantly, what about that conversation with your doctor? Okay, this happens a lot. Not every dentist gets it, or whoever the provider is. So when I have a client who has information and I have done my job educating them, they are able to confidently have a conversation with the provider, ask the right questions, make sure that they are going to be the right person to have on your team. So when you do that, when you arm yourself with information, you understand your impairment. So that means understanding why you might have some speech problems. It means understanding why you might be mouth breathing. Those are all things that we evaluate during an exam. So when I'm telling somebody, what to do, what steps to do everything, I always say get an exam. I suppose the first thing you can do is kind of do a screening. And if you're interested in that screening, at the bottom of this blog, you can sign up to get my free downloadable tool, which is going to help you screen yourself. Now, this is going to ask you a lot of the questions that I will again ask you in a comprehensive exam, but we're going to get deeper into that. But this screening tool is what a lot of my partners use in just helping determine if somebody really should move forward to a paid comprehensive exam. And the same is for you. So at the bottom of this blog, you can certainly get that. But let's talk about that exam. So when you go through an exam with me, of course, I can only speak for myself, you are going to get so much knowledge. We're going to talk about your tongue position and your mouth posture. We're going to talk about breathing. We spend a lot of time talking about congestion. If you are a mouth breather and you have chronic congestion, it's important that you understand that cycle of, I call it the vicious cycle of mouth breathing, and then understanding the tools, how we're going to get that better. It's important that you understand digestive issues and if they're caused by myofunctional impairment and what we can do to help that. What about that posture and what about head and neck tension? That's probably one of the greatest areas where adults say, Carmen, I am miserable and I want to figure out how to get rid of these tension headaches and just feel comfortable in my own skin. So I think that's great because wouldn't it be nice to feel comfortable, to not have that tension, not have any of these other symptoms that are related to myofunctional impairment? So with that said, find somebody. It doesn't have to be me. It needs to be somebody who is a myofunctional therapist who understands and can work with you, who can guide you, who can answer your questions. This can be somebody local. It can be somebody online. It's just so important that you find somebody to work with. So that person can help you understand where to start in terms of, assessment and intervention. So I welcome you to come on over to my Facebook page at The Tongue Trainer, and I'm going to talk today about my step-by-step process on how I guide my clients through the assessment, through all of that stuff to get ready for their intervention. So you can learn more over there. Again, if you want to take advantage of the assessment tool that I use, you can sign up for that at the bottom of this blog. That's going to give you some insight and it's going to help you understand whether you should really move forward. And with that said, remember, I am always here for you. You can always contact me. And I will see you in the next Myo Minute. Bye. Bye for now.